So now we'll see the topic called as pleural reflections. You can see in the screen pleural reflections, or the borders of the pleura and the borders of the lung. So it's very easy to remember over here. If you can imagine, this is the right side and this is the left side, lung and pleura, and centrally we will have sternum. This is a mandibular sternum body and this is a xiphy sternum. Yeah, on the right side, usually on the right side what happens is from the sternoclavicular joint. So this is the, yeah, if this is the clavicle, this is a clavicle, this joint is called as sternoclavicular joint, SCG. The sternoclavicular joint, from the sternoclavicular joint you need to draw a vertical line up to the seventh rib, up to the seventh ribs costal cartilage, costal cartilage. Yeah, this forms the medial border of the right pleura, right sided lungs pleura, medial border. Yeah, from the, now it is now reflected from this is the mediastinal pleura. This mediastinal pleura reflects to form the diaphragmatic pleura from the seventh rib costal cartilage in surface landmarks, as a surface landmark in relation to seventh rib costal cartilage. From here the reflection, the diaphragmatic reflection starts. It will cross the mid clavicular line. This is the mid clavicular line, mid clavicular line, that is the line between the line this passing to the center of the clavicle, that is mid clavicular line. Yeah, and if this is the axilla, axilla is the armpit, axilla or armpit, one and the same. The central line that is passing through the armpit or the axilla is called as mid axillary line, that is mid axillary line. And posteriorly, if we are going like this, if we are going like this, that is posteriorly, like this, posteriorly, the midline passing to the scapula is called as mid scapular line. Now opening up for the diagram purpose, if this is the scapula, the mid scapular line. If this is the axillary region, this is scapula, this is called as MSL or mid scapular line. Yeah, now this pleural reflection passes through the eighth rib in the mid clavicular line, 10th rib in the mid axillary line, 12th rib in the mid scapular line, as shown over here. Yeah, so that is, this region is like, it is going from anterior to posterior. Okay, from mid axillary line posteriorly, from mid axillary line posteriorly towards the mid scapular line, it is related to 12th rib. Okay, so this is about the, yeah, this is about the pleura reflections or surface landmarks of pleura. What about lungs? What about lungs? Lungs inferior border, I mean lungs inferior border is something different. It is related to sixth rib. Lungs is related to sixth rib in the mid clavicular line and eighth rib in the mid axillary line and the 10th rib in the mid scapular line. So this is the relations of the lung. These are relations of the lung. So the yellow shade represents lung relations and the orange shade represents pleura reflections. So similarly, left pleura, we need to discuss about pleura. It is also arising from the sternoclavicular joint, but it is ending at, yeah, we need to draw a line from the sternoclavicular joint towards the fourth rib, sorry, fourth costal cartilage. Costal cartilage. Yeah, from the costal cartilage, from the fourth costal cartilage, what happens is there will be a lateral deviation, lateral shift of around 2 to 2.5 centimeters, forming the cardiac notch. Forming the cardiac notch. This is called as cardiac notch, giving the space for the heart, and this runs through, this reflection joins sixth rib in the midline, and this will cross through 8th rib, 10th rib and 12th rib, okay, in mid clavicular line, mid axillary line and mid scapular line, similar to right sided pleura. Yeah, so these are the surface relations or the pleural reflections. And one another important point, this space is called as costodiaphragmatic recess. Diaphragmatic recess. Okay, recess is a space. So this, what is the importance of this costodiaphragmatic recess? It provides space for lungs to expand during inspiration. Yeah, this is the importance of costodiaphragmatic recess.